Hello, I'm Nima Kianford.
And my name is Nabil Fargo.
Today we'll be speaking to you about beam restricting devices.
One of the problems or challenges in diagnostic imaging today is scatter radiation.
In order to reduce scatter radiation, there are currently 3 devices in use by healthcare professionals.
We will be discussing beam restricting devices in this video, so we hope you enjoy it.
Stay tuned.
Thank you.
I mentioned to you earlier, there are currently 3 devices in use to restrict X-ray beams. First, we are going to talk about the aperture diaphragm, which is the most basic and oldest form of beam restricting devices. The aperture diaphragm is basically made out of lead and lead-lined metal placed in the tube to restrict the beams emitted from the tube. It is used to reduce breast tissue exposure, and the width and size of the aperture is fixed, so it cannot be changed, which is a limiting factor in the aperture diaphragm. The operator must be very careful when using this, when placing the aperture beam to reduce exposure to the
The
patient.
second type of beam restricting devices is the cone or the cylinder. Here we see the cone, and here we see the cylinder. This type is a modification of aperture diaphragm. However, there is a problem or a challenge with this beam restricting device, which is alignment, the alignment problem. Also, it is used mostly in dental radiography. Many dentists have chosen to use this beam restricting device to x-ray the teeth of the patients, and it's very effective at reducing scatter radiation. But there is a problem with the round coned image that it produces.
The third beam restricting device I would like to explain to you is the collimator. The collimator is the most effective at reducing patient radiation dose. As healthcare providers and as X-ray technicians, it is our utmost concern to make sure the patient is safe. Although there is no safe radiation dose, the collimator is the best and most effective one at reducing that, so limiting the risk factors for the patient. By doing so, the collimator also reduces the contrast of the image, which makes it more easy to interpret for the physician. The first part of the collimator works by controlling off-focus radiation, while an adjustable collimator is used for variable X-ray beam sizes, and by doing so we get the most efficient image from our X-rays. 3 factors that contribute to the increase in scatter radiation. The first one is X-ray field size. As you can see here, the larger the field size, the more scatter radiation are going to be produced. The second factor is the increase in the kVp, which is the energy. The more kVp, the more energy from the beam, the more scatter radiation we are going to produce. And the third factor that contributes to the increase in scatter radiation is the patient thickness or body part thickness in the patient. For example, when we're doing x-rays on the lumbar region of the patient, we are going to produce more scatter radiation versus the cervical region of the patient. Those 3
You realize that there are certain limiting factors or limitations that each one of these devices have, such as the coned image that is produced with the cone in the cone beam restricting device, and there are several other factors that we hope could be improved in the X-ray field as there are more advances in technology, and there are more scientific discoveries that we hope to have in the future in the X-ray field. We hope you enjoyed this video, and we thank you for watching it again.